Good morning, sir. I think we can start now.
Yes, Charlie, we can see.
Good morning, everyone. Thank you for your patience. Uh, we will start now. Dr. Jitendra, if you would want to take over.
Thank you, Chavi. So let's start with today's presentation. Uh, First of all, I would like to welcome all of you, uh, where we will be discussing and learning about what and how the India's future psychology workforce is meant to be, and how NCAHP is trying to bring the best of psychologists in our country and make everything ready for the future. Okay, so to initiate this, first I would like to introduce myself. I'm Dr. Jitendra Kumar Sinha. I work as Associate Professor at Department of Behavioral Health Sciences at Symbiosis Institute of Health Sciences in the Symbiosis International University, Pune. So when we are talking about psychology, it becomes very important to understand that what dynamic transitions are happening in the field. And to describe this thing, I think I should first tell that what presently it is there, and what changes are happening in the field to make you understand like why NCHP came with this new curriculum and the regulations. So initially, no, it was understood like mental health is important, and that is true. But yes, along with mental health, we need to understand the physiology behind it. And that's why it becomes very important to understand the brain health in in a holistic way. Right. So here in this image, you can see that what is integrated behavioral health model on which the whole curriculum is based, and how the things are working in present scenario. So as of today, what we see that psychologists, they receive patients having some disorders or mental disorders that are being precipitated in these patients, and they evaluate these patients and like their physical and mental health outcomes, different other disorders, and accordingly they do the intervention using different types of integrated or personalized care. But this is not enough, because as of today, we are missing the other important background things that should be also covered in it. So let's start with the understanding the integrated behavioral health model. And it starts with our brain. Our brain is made of neural circuits and its biology, which is coming into the picture by the understanding or the way our genetic constitution is working, different type of neural activities, how each of the neural subset is talking to each other using different neurotransmitters. And also all this is important because the type of stressors are affecting different brain regions. So the stress response as well as neuroplasticity makes the whole physiology or neurophysiology into picture. And when we are talking about the neurophysiological changes happening inside brain, they are all resulting into different changes in our behavior. And this behavior is consisting of different subsets like our cognition, our emotional behavior, and everything. And this includes our thoughts and beliefs, the kind of emotions we have for the same scenario. Different individuals have different emotional output. And this is very important to understand in terms of behavior. When we know that how the same uh, activity or incident is resulting into different emotional outputs in different subjects, that also helps us in understanding how different interventions can be designed or provided to these people. So it's very important to understand brain and then behavior, because it's not only about the patients, it's also about different programs or mental health programs where we try to improve the quality of understanding and different things that we will be discussing in the upcoming slides. So it also helps in understanding how an individual can improve upon the decision making or different coping strategies. So when we talk about brain behavior, it also leads us to understanding different lifestyle uh, paradigms, like how our daily habits in a certain environmental condition can be improved. So if we are living in a rural, very clean area, our lifestyle can be made in such a way that we make full use of it in improving our overall health, right? And when we are living in a urban kind of setting, then it's different, because it again results into just a minute. Sorry for the interruption. So I was talking about how the same scenario, or when we are talking about our lifestyle, it helps if we understand how different lifestyle factors are affecting our brain behavior and how it actually leads us to understand different type of disorders. We need to understand that our physical activity, the quality of sleep, the sleep hygiene that we are maintaining, the kind of nutrition we are taking, what is our social behavior in different environmental conditions, that actually helps us to understand the whole scenario. And when we are talking about a behavioral health scientist, it depends, or it becomes very important for a behavioral health scientist to actually program or design an intervention that can help the patient or your client. So it is extremely important to understand the whole uh, series of things that are presented on this slide for a behavioral health scientist, in present psychologists, so that they can assess the problem or the scenario, and accordingly they can intervene, they can coordinate, they can monitor in future, and also they have the capacity of evaluating using evidence-based and research-informed practice. It is not random anymore, that your gut feeling you are using for treating something. It is very streamlined, and of course your experience in coming years would also be helping you to get into better stature in this career. Right. So the overall goal of this uh, exercise is to optimize the brain health of different individuals or different clients that we have. And it also promotes well-being. It helps us in preventing different future mental disorders that the person can have. And overall, it enhances the quality of life, not only for the individual, but also for the family members. And in continuum, it is the whole society or the nation, right? So let's go in understanding how this shift is happening from just therapy or room therapy to an integrated care system. So you can see in the through this picture also that our brain health consists of mental health and the physiological brain health, right? So when we talk about mental health, we need to be free from depression, anxiety, PTSD, schizophrenia, and many other mental disorders. These mental disorders have a physiological factor in our brain. And when we understand as a mental health professional, we need to see that if the individual is having any kind of problem in their brain health, like neurodegeneration, or maybe there is a case of stroke or epilepsy or any other type of functional disorders. So as of today, mental health is integrating not only the psychology, but there is an integrated factors of our biology, the behavior, our lifestyle, environmental factors, and recently the daily or digital tracking that has also come into the picture as we see our different AI based instruments that we are using, including our smartwatch or smartphone, that are taking our data and actually telling us how different things can be done to improve our mental health through apps. So there is a rise of preventive and brain-based behavioral healthcare that we all are observing in this period. And also we can observe that there is a significant shift or movement towards interdisciplinary healthcare teams, where we will be needing more of trained people in future. So let's see what is the actually our country's mental health reality, right? So according to national estimates, 1 in 7 Indians are affected by mental health conditions. And if we see the key evidence-based indicators, we will see that more than 10% is the current prevalence of mental disorders. And this contributes to more than 15% of total dailies in India. And this data has been coming from our national estimates. And it also shows us that there is a big treatment gap. And you can see it is like 70 to 92% in different regions, where it consists of 70 to 85% of common mental disorders, and for the severe mental disorders it is 75 to 92%, which is really really high, right? And when we see this treatment gap, you can understand that even when people having mental disorders, as I'm saying, 1 in 7 Indians, out of, if we collect all these ones, means the people having mental disorders, they are not getting. So almost 70 to 92% of people who have mental disorders are not getting any treatment. And this is a really very scary situation in which we need a national policy which is being framed, which is there in place, and it needs a very well-trained workforce that we are trying to build here. In continuing this, it also shows that there is a large treatment gap across urban and rural regions where awareness is less. And also, in addition to this, we also are telling that there is a shortage of trained and interdisciplinary professionals. And this thing I'm telling about India, but we should not just see about no India, but also if we see the global picture, you will understand that even in high income countries, 1 in 5 people with major depressive disorders get minimal adequate treatment. Means if 5 people are there in high income countries who have any mental disorders, only one is getting the minimal adequate treatment. And this is again a very scary situation where overall in India as well, the whole world needs licensed clinical psychologists. And this is very limited as of today. And this is resulting into increased global uh, burden of stress-related chronic diseases. And if you are the one who is well trained in health psychology and prevention, you can be part of this professionally trained program, and in future it can be helping you to help different sects of society. So when we are talking about the whole scenario across India, across world, global scenario, you have seen that it is really alarming. We also need to understand how SIHS, that is Symbiosis Institute of Health Sciences, is having the value proposition where we are research driven, regulation aligned, and future focused. So I will be discussing about these things. And when I say, first of all, I should introduce the core faculty along with other 21 faculties in SIHS. These are our core faculty. We are headed by Dr. Girija Mahale, who is MD Psychiatry. She is a well-renowned psychiatrist having global experience in Australia, India, and many other places, and she has been guiding us and championing in different programs along with different consultations. Then I am Dr. Jiten Kumar Sinha, working here as associate professor. I'm a neurobiologist and uh, uh, academician here in SIHS. Then we have Dr. Minakshi, Dr. Chaya, Dr. Shruti Verma, then we also have teaching associates, uh, Teresa and Charvi. So we make the core faculty team here, and we teach different topics, and we have different specializations to cover the whole uh, syllabus or the teaching and training components. We also have different visiting faculties, and also we are supported by SCEW, that is Symbiosis Center for Emotional Wellbeing, where more than 40 psychologists are employed, and they have been teaching and helping us in different activities. Now coming to the neurobiological advantage that we have at IHS. So here we are having a strong foundation in brain and behavior relationships, where we try to understand scientifically why behavior occurs. So for just giving an example, on the right side of this slide, you can see that how the exposure to a trauma at early age can actually result into different behavioral mechanisms or behavioral outputs. So here you can see that if a kid is getting acute psychological stress or any kind of physical injury or infection at early age, it can train the brain into a different scenario where the brain starts sending signals to the peripheral organs in our body, and they are getting into the whole cyclic process of stress mechanisms, resulting into different types of behavioral mechanisms to cope up, right? It's not like just something is happening and A is resulting into B. We also now understand that this is happening due to different biological mechanisms where insufficient glucocorticoid signaling, different problems in gut, including the gut dysbiosis, results into different problems like obesity, poor sleep, psychopathology, or substance abuse, which is increasing and can be seen in our population in a rampant level. So all this is happening in our society at very young age also, and the neurobiological underpinning is very important to understand for a well-trained psychologist. And that's what we do here in our courses, to give a very well designed background to the students of our B.Psy and M.Psy programs, which are 100% NCAHP compliant. So our program is aligned with NCAHP. It has been recognized as a healthcare qualification under Indian law, and the structured curriculum at SIHS meets all the national regulatory standards as per the uh, today's law and regulations. Then also we are aligned with NEP, that is National Education Policy 2020, and also we follow all the rules of UGC for giving the 4-year bachelor's degree pathway. And you can see that our B.Psy program is made, or it is 100% aligned with NCAHP curriculum, which also helps the students to actually go for research intensive master program, where it becomes a streamlined progression, and a very well trained individual or behavioral health scientist can be produced after following all the system. Then also we have international academic mobility support, where you can complete these programs and then go for international academic higher degrees, including PhD or different sectors where psychologists are required. And that I will be also discussing in the future slides, where all uh, the students of ours are well fitted. So we also should discuss here the latest master's program, which is M.Psy, which will be coming into picture as soon as NCAHP comes up with the syllabus and the curriculum of it. So there are 3 career pillars that I will be discussing. So we have specializations like health psychology, where we discuss or teach about different methodology, different types of mental health problems. It can be physical, psychological, different type of research activities that we should understand, including the theory and methods, and also the interventions for the any change required in behavioral or mental health uh, problems. We also have counseling psychology, which makes a very important uh, part of psychotherapy, taking care of patients, handling different issues, and including different coaching work related specializations, right? So we have health psychology and counseling psychology as the specializations. The second pillar is research integration. Each and every student is having a compulsory supervised dissertation work to do, and uh, we like they are given a specific mentor as per mutual choice of different topics that we want to work on, and they all the students of masters are trained in research methodology, and presently our current batch students are already working on different topics, and few of them are uh, working on their publications. So we are training them not only in the curriculum, but we also provide different other training methodology, as well as the need of academics, which help them to grow much better in their future. We also help in improving the academic portfolio before graduation from our institute. The third pillar is very important for any student to have a very cohesive and mentoring ecosystem that we get at Symbiosis. We have so many uh, international level or international grade institutions here. We have in-house Symbiosis Center for Emotional Well-being, headed by our director, or the head of the department, Dr. Girja Mahale. And also overall, we have many other institutes or centers which gives us an opportunity for interdisciplinary healthcare learning and exposure at SIHS. Now, many of you would be uh, having a query in your mind that what are the different career pathways that are there for the B.Psy or M.Psy students after they finish their program, right? So it is very important to map your career ahead before deciding which program you should get into. And for this, you should understand that it becomes very important when we are studying psychology to understand that just reading or going through psychology courses is no more beneficial for a professional. They need to understand integrated behavioral medicine, which can only be possible if you work in close collaboration with different psychiatrists or different behavioral medicine teams. And this is possible in a place like Symbiosis University, where we have our own hospital and research center where we are located in the same building. So we have preventive health clinics where our students get internships as per their choice, and they learn firsthand as how they can be part of the system and this workforce in a very cohesive way in different hospitals and rehabilitation centers. Very importantly, corporate and digital health is something which has come up with a very big, knowledge and importance after post-COVID era. You should be knowing about employee assistance programs or EAPs, where different corporates or companies, they need to have a workplace wellness consulting. And for this, they are employing different mental health support employees or individuals on a regular basis for the consultation as well as regular checkups. So they get a permanent job in such kind of companies under employee assistant programs. And not only that, many of our students in bachelor's degree itself, they have started mental health startups because of the ecosystem I was talking about. We have entrepreneurship and innovation center in Symbiosis University, where there are trained people who guide you to, if you have any idea, we go to them, they will they will go through yours uh, propositions or slides, and they will tell how to improve it. And then from very starting to full-fledged startup, they will be helping in finding you different like no pointers where you are lacking, where it can be improved. Full-fledged guidance is provided by the university, and that is free of cost. So it is a very unique and very important part to understand as uh, a student of B.Psy or M.Psy program. We also understand that in this AI world, we need to have and good understanding of AI-driven health platforms, which are, even if it is made by someone else, you should know how to use it to get better. And we also have programs which help you to learn and develop your own health platforms. So if we talk about employee assistant programs, it's not only about mental health professional. That is not only the profession where you can be fitting, but also if somebody is providing or somebody is having an startup of personal coaching, when they are giving uh, no lectures or different modules of personal coaching, they also need a person having mental health or behavioral health uh, the scientific knowledge to be part of them. If somebody is giving financial coaching, they also need a mental health support system, along with smoking cessation programs or different fitness programs where people are talking about physical health. They also need to include the mental health support system. So you are individually enough, but also you become an very important part of other programs or other coaching individuals who need your support to be successful in their startups. With all this, you should also know that once you do bachelor's and master's program in psychology, there are other academic and research pathways ahead of it. So you can enroll for PhD in behavioral sciences or neurosciences or different other programs in health sciences, and you can get a different policy and public health roles, or you can be part of different clinical research careers in future if you have PhD. So all these things you get here in SIHS at Symbiosis International University. So you are the actual future of mental health care. And if you are well trained in this, the changing, the updated knowledge that we are providing here at Symbiosis Institute of Health Sciences, you can understand that the importance of research driven, being regulation aligned, and most important, future ready. You will be in safe hands. So on this slide, you can see we have the master's degree program as well as the bachelor's B.Psy program has started. So you can scan here. I would suggest you to take a screenshot of this slide so that you can contact us with any questions you have in mind. And with this, I would like to thank all of you for listening, and I invite questions if you have any. So Chavi, please see and
Yes.
let me know.
Thank you so much, sir. It was a wonderful and informative session. If you have any questions, please put them in the chat. Before we get to that, there are certain questions that students had already reached out to us. So I would like to get them clarified from you, sir.
Yeah,
So the first question here they're asking is what is the eligibility criteria for the B.Psy program?
wonderful. So like no, you can also go through the our website. But yeah, in short, I can tell that any candidate who has passed senior secondary, that is 10+2, or any equivalent qualification with science, arts, psychology, and have secured a minimum of 50% marks are eligible for admission. Right. And if we talk about age, the individual must be attaining the age of 17 years in the current year of admission. So this is the main eligibility criteria for B.Psy program at Symbiosis Institute of Health Sciences.
Okay, okay, sir. One more question that was asked is, can I apply for the M.Psy program after a BSc in nursing?
So for M.Psy program, to be eligible for it, the individual has to be a graduate from any recognized institution or university of national importance, specifically in psychology, mental health, social sciences, behavioral sciences, or any related field with a minimum of 50% marks. Okay, so that is the main criteria. And if you have nursing or any other bachelor's degree, please write to us on the email provided, and we will get back to you according to your credentials so that you can fill the form in time. Yeah.
Okay, sir. So one more question. Can the behavioral health psychology program, can it be done online? Is there a distance learning option?
Okay. So, like, no, according to the latest NCAHP guidelines, online and distant learning courses have been discontinued. Right. So currently, SIHS offers B.Psy, M.Psy programs that can only be completed on campus. We don't provide, as of now, any online or distant learning courses. But yes, for future updates, I would suggest you regarding any hybrid or online programs or any kind of bridging courses, please visit our website for more information on it.
Okay, so yeah, that makes sense. One more question is that are MBBS or BDS or BMS graduates, are they eligible to apply for the M.Psy course that we offer?
Okay, so only graduates in psychology, mental health, social sciences, behavioral sciences, or any related field, right? They are eligible for admission to the postgraduate program, specifically postgraduate program in line with the NCHP guidelines. But yes, if you are interested in these areas, I would suggest you that you can apply for the B.Psy program.
Absolutely. Also, does SIHS provide any internships for the students? Is another question that will come in.
Okay. Regarding internships, I would say that while department does not provide the internships as such, but institute has a lot of tie-ups and MOUs with various affiliated and other organizations such as hospitals, counseling centers, outreach centers, then rehabilitation centers, and many more, where our students can complete their internship. Of course, we provide support and help, and also help in connecting them to different institutions or different types of centers. Uh, but yeah, and importantly, we provide the support, and both the UG and PG programs include mandatory internships, which make them future ready. So we have different MOUs, we provide the support, and it depends on the choice of the student in which specific area they want to work. So accordingly, we provide the help. Yeah.
Okay. So another student is also asking, what are the practical components of the courses that are offered here in the bachelor's?
Okay. So talking about the practical components, the B.Psy and M.Psy courses are competency-based courses as per the NCHP guidelines, which are like no the main thing that we all need to understand, that we have to follow NCHP guidelines to its 100%, then only it will be valid in future. So all our courses are competency-based courses as per the latest guidelines, and through clinical postings at Symbiosis in University Hospital and Research Center here in-house, different visits to Child Learning and Developmental Center, training at skill labs. We also have skill labs here in Symbiosis University, different hands-on exposure to supervised research projects. Our students get to build a wide range of practical skills that are required to become an exceptional mental health professional. So most of the courses are designed in such a form that they make a very important integrated practical component uh, of the whole degree program.
Okay. So just a few more questions before we finish the questions that the students had. Now the student is asking, after the M.Psy course, what are the jobs that are available that they can do?
After which program?
After the postgraduate degree,
Okay.
M.Psy.
Okay. So if we talk about the postgraduate course, as I said, uh, being a specialization based on the specialization that we choose, like we have health psychology, counseling psychology, there are multiple career pathways that these graduates can choose. Let's suppose we are talking about health psychology. So with a specialization in health psychology, the graduates can take up roles like health promotion scientist, they can become behavioral health consultant, they can become public health advocate, as well as wellness coach, to name a few, right? And with a specialization in counseling psychology, there comes a like no plethora of possibilities, such as employee assistance or support worker, that EAPs that I discussed. Then community mental health services. Then we have rehabilitation counseling and different advocacy roles these students can have. So graduates can also work towards setting up their own private practice as a mental health practitioner after the program. Yeah.
Okay, okay, sure. And one person wanted more elaboration on what is the importance of the NCHP curriculum in the field of behavioral health. So if you could shed some light on that.
Yeah. So NCHP is the most important commission that comes into this picture. So the talking specifically about it, NCHP Act of 2021 seeks to regulate the whole of allied and healthcare professions, all of these, right? So NCHP provides guidelines on licensure and ethical practice for different mental health professionals, right? So when you are completing your UG and or PG degree from an institute who is or which is following NCAHP curriculum, then it ensures that you are eligible to become a registered and licensed practitioner going forward. It is not just like any like no additional course that you are doing, which is for your hobby, but these courses or the whole curriculum is designed in such a way that you become a well-trained, registered, and licensed practitioner and future ready. Yeah. So that is the importance of NCHP curriculum.
Okay, okay. So, and also, are there any age limitations to admissions, is what is being asked?
Okay. Okay. So for age limitations, as I said, the minimum age is 17 years, right? You should attain the age of 17 years uh, in the year of admission, as per the rule. And but yeah, there is no upper age limit for admission to both B.Psy or M.Psy programs that we have. So there is no upper age limit, but yeah, the lower age limit is 17 years.
Okay, okay. So that makes sense. And finally, there's one question that has been frequently asked, which is, will I be eligible for RCI registration after the postgraduate course?
No, no. RCI, that is Rehabilitation Council of India, that is different. So the B.Psy and M.Psy courses that are offered here in SIHS are aligned with NCAHP guidelines. So NCHP, NCAHP is for the allied health professionals, and which includes the psychology courses or programs. So B.Psy and M.Psy courses here, they are not falling, or the specializations that are offered, they don't fall under the purview of RCI regulations, right? So that is a separate thing. We have health psychology and counseling psychology as specializations in the M.Psy program, master's level. So yeah, it is different.
Okay, okay, so and a final question. A student is asking, what is the process for administration, or what is the procedure that they have to follow to take admission in the B.Psy or the MSc program?
Okay. So if we talk about the process of admission, it is a very streamlined process at Symbiosis. You just need to visit our website, and there you will find you can find different like no steps that you need to follow. Yeah, but for the sake of understanding, I will tell those steps in short. First of all, you need to register online there on the link provided. You have to submit your form, and then you need to submit or make an online payment of the registration charges. which is about 1,500 rupees. Then once you submit the online registration charges, you have to submit your SOP, that is statement of purpose, and in like no via your email within 3 days of submitting the registration form. The application will be considered, but yeah, you need to be understanding that if you are not submitting your SOP in time, it like no, your registration is not complete. So you need to submit the SOP. So prepare that well and submit it. And once you submit the SOP, we will be going through it. And if it is selected, we will invite you as the third step for online personal interview, right? So online you will be invited at a certain time, and online you can you will be interviewed, and then the result of that will be intimated to you via your email or phone number provided, right? Once this is done, the final selection, the last step is the final selection. This will be intimated to you via your email as well as a phone call. And then uh, once you submit, and then your different documents will be verified, then you have to pay your first installment of fees, and you are all done. You are part of us.
Okay, okay. Thank you, sir. There are a couple of questions in the chat as well. Abdul is asking, is there any scholarship for masters, either full or partial?
So you need to write to us with your credentials, your like no CV as well as different certificates, asking for different. We have different types of scholarships. So you need to write to us, and then on the email that is being shown here on the slide. So you can write to us. We will follow up with your credentials. If you are eligible for anything, any scholarship, we would love to guide you as how you can get any of these scholarships and join us.
Okay, I hope that was a clear answer. I am also have a question from Amit, sir. He's asking if we have any MSc in clinical psychology courses.
No, we don't run MS in clinical psychology here. That is not part of NCAHP.
Yeah, we only run MSc in behavioral health sciences, not clinical psychology. And even within behavioral health sciences, like sir mentioned, we have two specializations, counseling and health. There's also one more question from Vijaya ma'am. She is asking that she is a retired gynecologist. So, to which courses can she apply?
Sorry, can you tell again?
Yeah, so Vijaya ma'am, she says she is a retired gynecologist. So, she's asking which courses can she apply to?
Yeah. So, with a professional degree, like no, in master's program, it is not possible. But yeah, you can join us in B.Psy program, and also there is no age restriction for joining B.Psy program. And as a like no, if you want to further pursue, then you can also do M.Psy after that.
I hope that was clear, Jana. There's also Anush Sharma who's asking, is it a 2-year course for the postgraduate degree? And what is the price or the fees for the same?
Okay, so the fee structure is provided on the website. I would invite you to have a look. And also, as another person from audience asked, we also have different uh, scholarships available. So please write to us on this email, and we will get back to you specifically for your credentials.
Okay. If there are any more questions, please feel free to unmute yourself or put it in the chat. We will keep the floor open for another 2, 3 minutes.
Yeah, ma'am. Good morning. Do we have any diploma courses after M.Psy?
So we presently don't have any diploma courses, but yes, we presently run only NCHP aligned or approved B.Psy and M.Psy programs. Anything else?
Sir, is it a 2 year course?
Yeah. So the B.Psy program is 4-year course, uh, uh, and it is like no the way it has been designed in such a way that it follows 100% NCAHP guidelines. So it is now compulsory, I should say, that anywhere if you are doing a bachelor's degree, it should be of 4 years. The 3-year degree program is not valid.
I have also added the link to the website in the meeting chat. So for those of you who have questions regarding to the fee structure, you can visit the same site. It's in the meeting chat.
So if there are no questions pending, I would invite all of you to please visit our website. You can have all updated information there. And also, if you have any queries, any kind of questions in mind, please write to us on these email IDs, as well as we have provided the phone numbers on screen where you can call us in office hours, and we will be trying to help you out with any kind of questions or confusions you have. With this, I would also like to thank you as well as wish you all the best for your future.
Just before we end this meeting, I would request the participants to also, if possible, turn your cameras on so that we can take a quick photograph. Okay. Thank you so much, everyone.
Thank you, everyone.